In the name of Allah, the most merciful and beneficent. Today in this video we will discuss what are the diseases affecting the brain of ruminants and in which animal is unable to walk, unable to stand, and there is paralysis of the eyes, cheeks, lips, ear, and animal is supposed to be dying. Welcome into my YouTube channel. I am Dr. Muhammad Sattar Ahmed, a veterinarian. Today, in this video, you are looking this animal which is depressed, is suffering from a disease called listeriosis. What is the causes? What is the differential diagnosis? Typical signs and treatment of this very catastrophic, fatal, dangerous disease which is devastating many animals. Please subscribe and like this channel, because after very long time I am trying to elaborate this disease for your understanding, especially for those owners or pupils having small ruminants in their homes, in their ranch. Let's talk what is etiology. Listeria monocytogenes is an organism affecting the animals, especially sheep, but this organism also affect other ruminants like goat and cattle. The source of infection is a silage offered to animal which is not properly fermented, and this disease, especially adult animals, are entrapped by this disease, which means most adults are affected. This disease has three clinical findings. Number one is brain encephalitis, abortion, and third clinical form is septicemic form. This bacteria most of the time remain as intracellular organism, so it is difficult to treat because it safe from phagocytosis and produce listeriolysin otoxin and superoxidase dismutase, an enzyme which stop lysosomal activities. Condition number one, which is related to the brain of the animal, neurological. In initial stage, animals becomes depressed, separated from the flock, other animals. Hunching stance like kangaroo sitting posture. The fallen animal tries to escape, but due to incoordination in movement, again falls down. Later on, the depression leads to somnolence, a sleepy condition. There is infection of the trigeminal nerve, due to which the head of the animal is deviated to one side, and there is stiffness of the muscle of the neck. Walking in circle, unilateral facial paralysis, hypoalgesia, loss of sensation of pain, dropping of ear, paralysis of the lips. As you are seeing this goat, there is paralysis of eyelid, facial muscles, lips, and ear dropping. And there is also fall of eyelid, we call it ptosis, and there is inflammation of the cornea called keratitis, and this keratitis is so severe that it leads to corneal ulcers in the eye, and there is rotation of eyeball called nystagmus, and there is furthermore inflammation of the tissues of the eyeball called panophthalmitis, and there is accumulation of the pus in the anterior chamber of the eye, and there is blindness. The muscle of the jaws also become paralyzed, due to which prehension and mastication slows down, and there is drawing of saliva from the mouth. And we can just in this picture, this animal, I am trying to elaborate the condition. There is facial paralysis, paralysis of the lips, and there is minute movement of the tongue, but right side of the face, all the tissues, muscles are paralyzed. There is ataxia, animal falls to one side and try to escape, try to arise again, but unable to arise. And due to the distress, due to the paralysis of the respiratory muscle, there is death of the animals, because death denies, death defies the doctor, or death keeps on no calendar. Second form of listeriosis is abortion. In last trimester of the cattle, there is abortion, and in sheep and goat, abortion occurs at 12th week of gestation, and we can see bloody discharge from the vagina, which indicates abortion. And there is third specific form, which is most of the cases observed in calves and young lambs, which shows weakness, emaciation, pyrexia, diarrhea due to enteritis, with the hepatic necrosis and gastroenteritis. In calves, there is corneal opacity, dystocia, nystagmus, and death of the animal within 12 hours. And in milking animal, there is mastitis of 1/4, which most of the time remains as chronic form, and the muscle of the sides of the spinal cord are affected, knuckling movement of hind limbs, and later on knuckling of the forelimbs. As you are seeing in this video, this goat is also suffering from this disease. There is one side paralysis of the fascia, facial muscles, ears, eyeball, lips, and this goat is unable to stand and pedals its legs. Now, what is the differential diagnosis of this disease from other? Number one is scrapie, which is due to the prions protein in feeds, and there is no response toward treatment. Second is ketosis, in which animal also exhibits neurological signs, abnormal behavior, and there is history of the poor nutrition in case of ketosis. And third is rabies, in which animal also shows behavioral change, and there is behavioral history and history of the biting of dog. There is also fourth disease, which is pregnancy toxemia, which is almost only in pregnant animals. Or there is deficiency of thiamines, PEM, polioencephalomalacia, cortical necrosis of the brain. Now, what is the treatment? In first, chlorotetracycline in cattle at the dose rate of 10 milligram per kg body of weight for 5 days intramuscular. We also use penicillin G at the dose rate of 44,000 international unit per kg body of weight for 7 to 10 days in sheep and goat. And there is deficiency of electrolytes in case of diarrhea, and there is pyrexia. Initial, we can treat antipyretic, for example, flunixin, meglumine, ketoprofen, meloxicam, and for corneal opacity, we use dexamethasone at the dose rate of 1 to 2 milligram per kg body of weight, or mannitol at the dose rate of 25% slow IV, and thiamine 10 to 20 milligram per kg body of weight is given slowly, and we repeat this thiamine dose after 4 days for fast recovery. And there is also deficiency of glucose. For this purpose, we recommend 10%, 25%, 50%. If we are giving 50%, only 50 ml is given IV dextrose. And calcium therapy is also beneficial in this case, and we administer 25 to 50 ml, and 25 given IV, 25 subcut. And these treatment should be continued for 3 to 5 days for recovery of the animals. I hope you will have subscribed my channel for further notification. Please like, share this video for good result for the recovery of the animal. We should continue these medicines 3 to 5 days, so animal becomes good and can stand and walk. Thank you for watching my channel. Please do not forget to hit the bell icon so that you can get notifications of my coming videos. Thank you so much. Assalamu alaikum wa rahmatullah.